When assisting residents with urinary elimination, their urine should be observed for the characteristics described in the table above. Terms used to document these characteristics are included. Characteristics of urine can be indicative of a urinary tract infection or dehydration and should be reported to the nurse. Dark urine, minimal urine output, or the infrequent need to void can be signs of dehydration. Characteristics of an infection are described in the previous urinary tract infection (UTI) lesson. If noted and reported promptly, fluids can be encouraged to help treat these conditions. Similar to urine, stool output and characteristics can indicate underlying health concerns. Risk factors to healthy stool elimination will be discussed further in later modules. However, slowing of the digestive system, decreased intake, and lower mobility can all contribute to constipation and even cause bowel obstruction. Documentation and reporting of unusual characteristics can assist nurses in providing interventions that can prevent more serious health concerns. Elimination patterns vary for individual individual, but a typical range for bowel elimination is twice daily to once every other day. When regular bowel movements do not occur, stool becomes hardened in the colon, making it difficult to push out, especially for those who are physically declined. Stool should be soft and formed when eliminated to prevent additional problems like hemorrhoids. Stool that is loose or liquid may indicate an infection or other chronic intestinal issues. Nursing assistants should note the size of a client's bowel movement as small, medium, or large as an estimation. Using agency protocol, the consistency of the stool should also be documented. The Bristol stool chart is a common tool used to easily observe and document the consistency of stool. See the Bristol stool chart above. Additionally, if any blood or dark tarry stool is observed, this should be reported immediately to the nurse. If a resident is regularly incontinent and uses a brief or disposable pad for elimination, the nursing assistant should document the number of times the resident is incontinent rather than recording the amount. If the resident uses a commode or bedpan, place a graduated cylinder on a barrier, carefully pour the urine into the graduated cylinder, and observe and document the characteristics. See the image of a graduated cylinder. For a continent resident, use a toilet hat to measure urine output. When assisting in collecting a urine specimen, place the cup and toilet hat on a barrier to prevent contamination with bacteria from the environment. Apply gloves and assist the client when needed to clean around the urethra to remove any external pathogens. If able, ask the resident to void a small amount of urine into the toilet. Place the toilet hat in the front of the toilet and instruct the resident to void into the hat. Do not put toilet paper or any other products into the toilet hat. After urination, assist the resident in completing perineal care and transferring from the toilet. Remove dirty gloves, perform hand hygiene, and apply new gloves to prevent contamination of the urine with bacteria from the perineal area. Pour the urine sample from the toilet hat into the specimen cup and tightly put on its cover. Remove gloves and perform hand hygiene before writing the time of collection on the label. Immediately bring the urine sample to the nurse. Remember, urinary samples may need to be collected to detect infection. Ask the nurse to label a specimen cup before collecting urine. Stool samples are collected from patients to test for cancer, parasites, or for occult blood, i.e., hidden blood, the guaiac-based fecal occult blood test. GFOBT is a commonly used test to find hidden blood in the stool that is not visibly apparent. As a screening test for colon cancer, it is typically obtained by the patient in their home using samples from 3 different bowel movements. Nursing assistants may collect GFO-BT specimens for clients. Before the test, the nurse should verify that the client has avoided red meat for 3 days and has not taken aspirin or nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, for 7 days prior to the test. Blood from the meat can cause a false positive test. An aspirin and NSAIDs can cause bleeding, also leading to a false positive result. Vitamin C, more than 250 milligrams a day, from supplements, citrus fruits, or citrus juices should be avoided for 3 to 7 days before testing because it can affect the chemicals in the test and make the result negative, even if blood is present. To perform a GFO-BT in an inpatient setting, perform the following steps. Verify with the nurse that the client has met dietary and medication requirements. Explain the procedure to the client. Assist the resident to a clean, dry commode and instruct them not to put any toilet paper in the commode, as this may alter the test result. Request they use the call light when they have had a bowel movement. Review the manufacturer's instructions with the nurse. Label the card with the patient's name and medical information per agency policy. Open the flap of the GUAIC test card. To perform a GFO-BT in an inpatient setting, perform the following steps. Apply non-sterile gloves. Use the applicator stick to apply a thin smear of the stool specimen to one of the squares of filter paper on the card. Obtain a second specimen from a different part of the stool and apply it to the second square of filter paper on the card. Occult blood isn't typically equally dispersed throughout the stool. Place the labeled test card in a transport bag. Remove gloves and perform hand hygiene. Give the transport bag to the nurse to send to the laboratory for analysis.